Welcome back. When it comes to knee and ACL tears, humans aren't the only ones at risk. Your dog can also suffer from these injuries.
Yeah, Dr. J.B. Erne is a board-certified specialist in surgery at Affiliated Veterinary Specialists. And for those of us who don't know much about AVS specialists, how long have you guys been in Northeast Florida? And tell us a little bit about what the goals are for AVS.
Well, we've been in this area for about 20 years now, and so we actually have 4 different hospitals in Jacksonville, Orange Park, Daytona, and then also in Gainesville. And so we just provide more advanced surgical care for veterinary patients in the area. So
I think it's important to reiterate that, and because veterinary makes people think, oh, I go get my checkups there and stuff, but it says it in the name, specialist. Right. It's not your regular checkup place. You need to be referred, right?
Right, correct, yeah. We are purely a referral hospital, so the family veterinarians refer their patients over to us for more advanced care that they might not be able to provide.
And tell us about your role at AVS.
Yeah, so I'm one of the board-certified surgeons at AVS, so I work specifically out at the Jacksonville office. So, and I do both orthopedic and soft tissue procedures at that facility.
All right, and so we talked about it in the lead there. What are the orthopedic issues you're seeing with pets right now?
Well, we see a wide variety of orthopedic conditions. We see a lot of fractures that come in as well from trauma, but ACL, or what we call cranial cruciate ligament injuries, are by far the most common orthopedic condition that we encounter.
Is this something that you guys are just, the science has moving so far forward, you're actually recognizing it's been happening all along,
yeah.
we didn't realize it?
Yeah, dogs have always had ACL tears. It's just we do a much better job these days at recognizing it, and then also owners are just more in tune with pain with their patients or their pets. So they see their dog limping, so they're going to want to know why their dog's limping, because they don't want them to be in pain. So
yeah, you hear ACL, and obviously you think of like people and runners and whatever.
Right.
But so what kind of risks then do dogs go through that would make them come see you?
Well, it's a little different. ACL injuries are largely sports-related injuries in us. Whereas in dogs, it's actually more of a chronic condition. So they actually may have an ACL tear for many months, up to a year. It's just a gradual tear of the ligament. So, but certain breeds are prone to this. So there is a bit of a breed predilection to it as well. But
which are? I'm curious. What would
well,
those
Labradors. We see a lot of boxers. Pit bulls are commonly developing ACL tears. But we see ACL tears in little Chihuahuas all the way up to Great Danes. So,
wow.
It's kind of runs the gamut.
Well, that's the thing. My roommate last year went through an ACL tear. I watched him go through the rehab. I actually was on the flag football field 5 feet away when it happened, so I've gone through the entire process, but that's a human who can be told, stay off it, do this. Yeah. With our pets, it's so hard. How are you getting them are they wearing the braces?
Nope, not at all. Yeah, our job's actually the easiest, repairing it. It's the job of the owner that has the toughest job, because they have to be in charge of keeping their pet quiet and somewhat restricted. And sometimes we're doing these surgeries on 1-2-year-old dogs who just, once they start feeling better, they're going to want to start running around.
Right.
So, yeah, you'd be amazed. And I think the important part about it is that surgical stabilization of their knees is very, very important. Any other method to try to get them to heal is not going to work very well.
So what is the problem? Are you casting it after you do it, or
no? Actually, we don't use any sort of external device or bandage at all. So we actually use and promote rehabilitation therapy. So it's very important for them to start using their leg soon after the surgery. So we do have a rehabilitation therapist with our hospital that can do rehabilitation therapy or physical therapy afterwards as well. And there's some other physical therapists that do mobile as well. So, so there are some good options for that.
And do you notice that owners sometimes wait too late? Like they see the dog limping and they think it's something that'll just work itself out?
Yes.
I would think so, because like you were saying, the dog can't complain and say, hey, I think it's my ACL. So then what do the people need to do as soon as they start to see something that's wrong?
Well, if your dog's limping, it's painful.
Yeah.
I think that's, even though they're not vocalizing or crying out in pain, if they're limping, they are experiencing pain. So it's better to get that checked out when it first starts happening, as opposed to waiting and
Yeah.
just hoping it's going to get better. And in some situations it may get better for a short period of time, but then the limping comes back. But it's really the best thing to do is once you see your dog start limping is go to your family vet, have them check it out. And if they feel as though it's something that we need to see, they'll refer you over to us.
Yeah, because dogs and cats, they don't fake limp to get sympathy like
No.
like some humans do.
No, they don't
Mostly
feel sorry
men.
for themselves.
Had to throw that in there. Thank you.
Probably
Yeah.
true. We'd like to
Thank you,
thank
Dr. Erne.
Affiliated Veterinary Specialists for making that segment possible. For more information, visit avspethospitals.com. You can call the Jacksonville office at 904-646-1287 or call the Orange Park office at 904-278-0287.